service will be held sometime next week at Arlington National Cemetery. Today marks the beginning of a 3-day tribute in Washington to Justice Ginsburg, who passed away last Friday. Our Joe St. George is in Washington and introduces us to the men and women guarding her casket over these next several days.
Thousands of Americans will stand in this line outside the U.S. Supreme Court over the next several days just for the chance to stand a few feet from the late Justice Ruth Bader Ginsburg's casket. There are, however, a few hundred men and women standing a bit closer, her former clerks. In fact, as Justice Ginsburg's casket arrived at the High Court this morning, it was her former clerks who lined the steps to meet her casket. Men and women flying in from all over the country to be here. They will take shifts now, standing near the casket over the next several days, guarding it, keeping watch, serving their boss one last time. Ginsburg was well known for keeping a close relationship with her clerks. Clerks are young attorneys who, for just a few months in their careers, research and write for justices. Colorado's Attorney General Phil Weiser is a former Ginsburg clerk who spoke with us about what it's been like on the steps of the Supreme Court today.
It's hard to believe she's gone. And so part of what this moment is coming to grips that we've lost such a giant who's meant so much to all of us.
What was her relationship like with the clerks?
She definitely remembered and she cared. My kids both had the chance to get to know her. I brought my daughter here.
Now, it is not a new tradition of former clerks serving as honorary pallbearers. It is one that goes back decades. In Washington, I'm Joe St. George.
Joe, thank you. With COVID-19 cases on the rise all over the state, local healthcare workers are worried hospitals won't be able to take care of everyone. NBC 26's Jenna Bree tells us why we all need to continue to play our part.
This is really our time to take care of ourselves and then to take care of each other.
Dr. Jennifer Frank says people in Northeast Wisconsin aren't acting like there's still a pandemic going on. People aren't wearing masks properly or at all and keep gathering in bars in crowded places.
That's a normal part of human behavior. You know, we're gung-ho in March, and by September it's gotten old and boring.
But Dr. Tom Nichols says right now hospitals are seeing the highest number of COVID-19 patients since March, and healthcare workers are stretched thin.
They also live and work in our community. They have kids in our schools.
But the biggest concern right now is the upcoming flu season.
The combination of any flu season with an emerging pandemic is something nobody has experienced before.
COVID-19 and the flu are clinically indistinguishable. That means if you go to the hospital with a fever, a cough, a headache, doctors have to assume you have COVID-19 until they can test you and get that result back. You would have to self-isolate until they know what's going on.
We cannot tell by doing an exam, getting a history, which one it is.
Frank says all that extra testing would add more of a burden on the healthcare system. That's why this year it's going to be more important to get a flu shot than ever before. Jenna Bree, NBC 26.
Jenna, thank you.